If your doctor has talked about repairing a heart valve, here's what that actually means. The heart has 4 valves that work like one-way doors, opening to let blood flow forward and closing to stop leaks. When a valve leaks or doesn't open fully, the heart works harder, often causing breathlessness, fatigue, and swelling. In valve repair, surgeons rebuild the patient's own valve instead of replacing it, using rings, stitches, or small tissue patches. Major guidelines favor repair over replacement when possible, especially for the mitral valve, because it preserves natural tissue. Repair is most common for mitral valve leaks, often from prolapse, and is also used for tricuspid and some aortic valves. During surgery, the patient is on a heart-lung machine while the surgeon places an annuloplasty ring, reshapes leaflets, or adds artificial cords. Surgery is done through the breastbone, or in selected patients through smaller side incisions or robotic ports. Patients usually spend a day or 2 in intensive care, then move to the cardiac ward to start walking and breathing exercises. Hospital stays are typically 5 to 7 days, and most patients return to normal activities within 6 to 8 weeks. Structured cardiac rehabilitation builds fitness safely and helps protect the heart for the long term. Like any major surgery, risks include bleeding, infection, irregular heart rhythms, and rarely a need to convert to replacement. Most patients keep their own valve for many years, often without lifelong blood thinners, with regular follow-up and echocardiograms. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost. Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.